as well as Max from the Australian Digital Health Agency. We would first of all like to acknowledge that for me, I'm meeting on Aboriginal land this afternoon, and I'd like to pay my respects to elders past, present and emerging, and just recognise the work that we're doing contributes to closing the gap for Aboriginal people across the entire Hunter, New England and Central Coast region. We would like to record today's session, and if anyone would like, if anyone has any issues with that, please feel free to reach out to myself or one of the members of the call via the chat button. The chat is being monitored, so please don't hesitate to reach out. We've deliberately turned off cameras for this session in the settings of Teams, just in being mindful of people's privacy and any privacy concerns. So our understanding is that people's names and any identifying elements of their screen presence won't be captured on the recording. It will just be the slides that are recorded. There will be time for questions and answers at the end, and as I said, the chat is being monitored. So please keep your questions to the time at the end, where there will be plenty of time, and there'll be the opportunity to ask those questions then. What we want to go through today is just some basic information to introduce everyone to the My Health Record, particularly for commissioned service providers, given it is one of the elements of the standard terms and conditions of your contracts. So we will go through what the record is and some of the benefits of using the My Health Records, and include that some of the systems and securities that are in place to protect clients and the data that's stored in the record. We'll then go on to talk about how your organisation might register for accessing the record and what support is available from the PHN. And as I said, we've got Max from the Australian Digital Health Agency joining us on the call, and Peter Mullins, one of our digital health team members, will also be presenting today. So just to kick off and to format and Peter present their slides, I just wanted to acknowledge that the PHN acknowledges that the My Health Record is a key element of any digital health strategy and digital enablement that service providers might have. And as I touched on earlier, it is an element in our standard terms and conditions for all of our contracts. And key elements of that are that the standard terms and conditions require all of our contracted partners to not only access the My Health Record when they're eligible to, but also to supply patients, carers and consumers with information about the My Health Record. If they are eligible organisations to register for the My Health Record, then there is a requirement that the organisation is able to register and access the record, and that does include any eligible subcontractors. At a minimum, to be registered, we expect that organisations that we're working with will be able to register and at least view the record through the National Provider Portal that's available. And with that comes some requirements to then implement some security and access policies for the organisation, which is also referred to as a digital health policy. And for those people that have got light user access to Folio, some of this information is contained in the provider toolkit, which is available in the Folio Launchpad, but it's also available on the PHN website. And when we send the slides around after the presentation, there is a link on this slide particularly to access the provider toolkit that's available. I'll now hand over to Max, who will be able to take you through an introduction to the My Health Record. You're on mute, Max, sorry.
Thank you, Amanda. And thank you for that introduction as well. So as Amanda has mentioned, my name's Maxwell Blobergs, and I work as a digital health educator with the Australian Digital Health Agency. So I'm going to be taking you through an introduction to My Health Record. So to start off, I'm going to talk to you a little bit about the National Digital Health Strategy, just to give you some idea of where the agency is working when it comes to dealing with the National Digital Health Strategy. So the Australian Digital Health Agency has worked in cooperation with the Council of Australian Governments to create the strategy. And it's really tasked with improving health outcomes for Australians through the use of digital health education, as well as supporting healthcare providers to implement digital health tools into their practice. So in the strategy, as you can see, we have 7 priority areas. So the first is My Health Record. Second, we have secure messaging, so exchange of health information in a secure manner. Then we have data interoperability and data quality as well. Medicine safety, which incorporates electronic prescriptions, enhanced models of care, workforce and education, as well as driving innovation. But for today, we're going to focus on the first priority, which is the My Health Record. So the My Health Record is not something new. It's been around for a long time. It's been operating for many years. So we currently have more than 23 million records in Australia. And within those records, more than 22 million actually have data within their records. And so that comes to close to 9 out of 10 Australians having a My Health record. So most of you online today would already have your My Health record, which you can access through your MyGov account. So what is My Health Record? Okay, so to give you a bit of an overview, it's essentially a secure online summary of an individual's health information. It's personally controlled, so a person can actually choose how much they interact with their record. If they want to, they can set access controls when there's concerns around privacy. It's part of a national system, so that means that it is available all around Australia at any time of the day, so it can be accessed 24/7. And there's also a number of different security measures to ensure that data in the records remain safe and secure. So there's data encryption, firewalls, 24-hour system monitoring, and My Health Record is not only protected under cybersecurity, but there's also legislation in place to ensure the correct use of the system. So currently, how are healthcare providers using My Health Record? So as you can see here, we have 99% of pharmacists around Australia that are pharmacies that are connected and using My Health Record. We have 99% of GPs, general practices using My Health Record. 95% of public hospitals are connected and using it. And from the public hospitals, we're seeing the uploading of discharge summaries to My Health Record. And then also we have a new space for specialists. So at the moment, we're in the process of connecting with more and more specialists. So currently we have 22% of specialists around Australia connected and 10% are using My Health Record, but these numbers are continuing to increase. So what's inside My Health Record? So we can see here there are 608 million documents that have been uploaded by consumers and healthcare providers. So to break that down, it's 246 million clinical documents, 362 million medication documents. So those would be uploaded from pharmacists and GPs, as well as consumer documents there, close to or just over 400,000 consumer documents as well. So one question we often get asked when it comes to My Health Record is, do you have the authority to go onto someone's My Health Record? So a healthcare provider who has a legitimate reason can access the system. So a provider is authorized to access My Health Record if they're providing healthcare to a patient. So you have the authority to view My Health Record if you're providing healthcare to the patient. Also, just to be aware that My Health Record is not to be accessed for insurance purposes or employment purposes as well. So it's only for healthcare providers who are providing healthcare to the patient. When it comes to uploading documents, it's the same. It is for a healthcare provider who is providing care to the patient. They can upload documents to that patient's My Health Record. However, it is best practice to speak to a patient when you're uploading to their record, just so that they know what's on their record, so that they can share that with other healthcare providers. And even in certain state and territories, if the information you're uploading contains sensitive health information, you will need to check with the patient before uploading that information. But as I said, it is best practice to check anyway when you are uploading information, especially sensitive information, to a patient's My Health Record. So what documents are available? So documents really fall under three categories. So we have the provider documents, consumer documents, and Medicare. So under provider documents, you can see shared health summaries. So that's a summary of someone's health uploaded by general practices, discharge summaries from hospitals, pathology reports sent through from pathology providers, diagnostic imaging reports as well, prescription records, dispense records from pharmacies. So all of those provider documents are getting uploaded to a patient's My Health Record. Then we also have the consumer documents. So consumers can add a personal health summary. So a consumer can write about their personal health story, their mental health story. They can create what's called a personal health summary, just so that they don't have to repeat that story over and over again, especially if there is trauma involved with sharing that story multiple times. That's an advantage of My Health Record, is they can actually they can upload the personal health summary. They can also upload personal health notes. They can upload emergency contacts, advanced care plans. And then also there are Medicare documents pulling through into My Health Record. So you have your MBS and PBS claims pulling through. The Australian Organ Donor Register status pulls through, and the Australian Immunization Register records as well. So the AIR records pull through as well. Now, in the middle, you'll notice we have some overview documents. So these are system-generated documents. So they take all of these various documents and they put them into a specific overview document that is relevant to the area. So whenever you're looking for anything to do with medicine information, you'll be able to find it within the medicines information view. Medicare information can be found in the Medicare Overview. Immunization Consolidated view for immunizations, and then you can find pathology and diagnostic imaging reports in the overviews as well. So when you open up your medicines information view, this is what it looks like. So here you'll see the dispense records from pharmacies, prescribing records, Medicare information. And when you open it up, you'll see the navigation panel up the top. So here you can see what your patient's allergies are, and patients can actually upload their own allergies as well, just so that they ensure that all of their allergies are acknowledged when they are receiving treatment. There's also the medicines preview. So here we can see all the different medication that patients are on, and you can see the name of the medication, the dose and directions. You can see the date that the information was uploaded, and you can also see the source document where that information has actually come from. So you can click on these links here to go through to that source document. Then we have the immunization consolidated view. And so here we have the immunization information pulling through from AIR. So that's quite helpful that that providers can access information from AIR through My Health Record, rather than going through all of the steps of logging onto AIR. Then you can also see immunization information pulling through from shared health summaries and event summaries. And you'll notice here within the immunization view, we have a COVID-19 immunization status. So we can see if our patient is up to date or not with their COVID vaccinations, and we can see when their next immunization is due and the due date as well. So as I mentioned, you can also see pathology reports in the Pathology Reports overview. And so these pathology reports are grouped according to test name and collection date. On the left here, you'll see the different pathology providers that are connected to My Health Record, and they've uploaded the reports. So if you're not seeing the reports, it could be that the patient was sent to a pathology provider that isn't connected to My Health Record and uploading the reports. And so if you want to see who is connected, you can type into your browser pathology providers connected to My Health Record, and it'll take you through to our website where you can see who are all of the pathology providers that are connected. If you want to view the report, so for example, if I wanted to view this HbA1c because I have a diabetic patient, I could then just click on this report here and it will open up. And currently we have 206 million pathology reports in My Health Record. And also we have the Medicare overview. So here we can see our prescription information pulling through from AIR. We can see the Australian Organ Donor Register status and Medicare services. So here under Medicare services, we can see who are all the different service providers in our patient's healthcare team. We can see what they have been claiming and also the item number. So this can be beneficial if you want to see if your patient is eligible to claim certain services, such as the mental health care plan. Also, another valuable document that's available in My Health Record is the Shared Health Summary. So as the name sounds, it provides us a summary of a patient's health in 4 key areas. So it represents the patient's health status at a point in time. So you can see the allergies and adverse reactions. You can see medications, medical history, as well as immunizations. And so this document can be uploaded by the patient's nominated healthcare provider or their regular healthcare provider. And the reason it's their regular healthcare provider is because it makes sense. They would have all of this information within their clinical information system, whereas if you hadn't seen a patient before, you wouldn't have any information about them. So it's the regular healthcare provider that uploads the shared health summary, and that could be a medical practitioner, could be a registered nurse, or an Aboriginal and Torres Strait Islander health practitioner. Another valuable document that can be found in My Health Record is the event summary. So the event summary can be uploaded by a nurse, including an enrolled nurse, a doctor. It can also be uploaded by allied healthcare providers that have access to a conformance clinical information system. So when you are uploading documents, it's done through a conformant clinical information system. So the event summary document captures key health information about a significant healthcare event. So the shared health summary is sharing all of the data about the patient in those 4 key areas, whereas the event summary is detailing a particular event. So when a patient comes into, just for example, if they came in to see a GP, the GP types up their notes, they order the medications, they order the diagnostic investigation tests, and then after doing all that, they then go ahead and upload an event summary as well. And then that information gets detailed from the event summary. Also, a recent enhancement in My Health Record is the ability for specialists to upload the specialist letter. And this is something that a lot of practices have been wanting for a while now. So it's fantastic that we can offer this. And so specialists are able to put in their information about the patient, and that can be accessed very easily through My Health Record, rather than going through that whole process of trying to track down the specialist letter. And as you can see here, we have a genetic specialist letter, and then in certain software, you can see the specialist letter with the letterhead as well. It depends on software functionality. So some of the benefits of My Health Record for the healthcare team is it provides that greater visibility and understanding between healthcare professionals that are involved in the patient's care. So it's all about that sharing of health information between different healthcare providers. And so the more information that's there, the better the system becomes, and the better it is for patients as well, because it's really sharing that information and creating that continuation of care. It can be especially beneficial in terms of that mental health journey by creating a personal health summary. Um, then the provider can see the mental health journey for that patient, as I mentioned, without the patient having to go through the whole story again, especially when it can be traumatic. There's also improved access to medication history, prescribed medications, clinical information, and it really helps with coordination of care and supporting care for clients and their carers as well. So some of the benefits for clients is that it enables clients and their carers to keep track of their health history, keep track of their medication, so they can make sure they're taking the correct medications as prescribed, promoting that continuation of care, especially when they're moving or going between different services. Um, Reducing the client's need to retell their mental health story, as well as improving self-management. So it's about empowering patients to take on their health care. So some of the ways that My Health Record can add value to practice, it can help with medication reconciliation. So through going through the medicines information view, can help with history taking, patient assessments, rather than sourcing out all that information. It can be found within shared health summaries, discharge summaries. It can avoid duplication of tests. So if a patient's already had those blood tests, you don't need to send them to have more blood tests. You'll be able to see those results within My Health Record through pathology and diagnostic imaging overviews. So also with diagnostic imaging tests, you'll be able to see those in My Health Record. And it also helps to inform end-of-life care, especially when it comes to advanced care planning and following a patient's advanced care wishes as well. So what about privacy and security? So we often get questions here at the agency around My Health Record and security, and there are many safeguards in place to protect the system. So there is strong encryption firewalls, there's secure login processes, there's audit logging as well. There's a cybersecurity team that monitors the system 24 hours a day, 7 days a week. The health information is protected under legislation, and there are significant penalties for misusing the information that is in My Health Record. All data is also stored securely within Australia, and it is protected under high-grade security protocols as well. So as I mentioned, patients can be in control of their own My Health Record. I know there has been instances where an individual has opted out of getting a My Health Record because concerns about privacy. But when they realize they can actually be in control and they can see who's accessing their record and monitor everything, then their concerns have been somewhat alleviated, and they were happy to join up and get a My Health Record. So patients can actually set what are called limited document access codes, so they can limit access to certain private documents that if they wish to. They can establish what's called a record access code. So when you're seeing the patient, you would need to ask them for their access code, and then they would give it to you. Just say it's 1234. You type that into the system, and then you would have full access into their My Health Record when you're sitting with them. Also, there is an emergency break glass facility that is available as well. So if there is indeed an emergency, it can be used. However, it's best to document the reason for using the emergency access, because it needs to be considered an emergency. And patients can also choose to receive an SMS or email to alert them when a provider has accessed their record. And all instances of access to My Health Record are logged as well. So how does My Health Record work? So for providers, for healthcare providers, they can access it through a conformant software. So that's a system who's gone through the conformance process to determine that it's safe and effective for hosting My Health Record within that software. Also, My Health Record can be accessed through the National Provider Portal. So if your organization doesn't have access to conformance software with My Health Record yet, then you would be able to access My Health Record through the National Provider Portal. When it comes to uploading documents, that is done through a conformance software with the National Provider Portal. It's for viewing, so you can't upload documents, but you can still see all of that valuable health information that's there. You can print out documents, you can save documents to your local system as well. So there's a lot of value through accessing My Health Record through the National Provider Portal. Now, as patients, as you or I, as a patient, we can access it through MyGov, and we can actually upload documents through MyGov. So that's where I was saying you could create a personal health summary, and you could share information about your health that you wish to share with other healthcare providers through MyGov. You can upload. Otherwise, you can also view My Health Record through MyGov or authorized apps as well. So when you are viewing My Health Record, as I mentioned, it can be through a conformance software. If you're not sure if the software within your organization is conformant, you can check the digitalhealth.gov.au register of conformity. Otherwise, as I mentioned, you'll be able to access My Health Record through the National Provider Portal. So you may be wondering how you can get connected and start using My Health Record. So before you can use My Health Record, you need to register register your organization for a My Health Record security and access policy. And this is a requirement for access to My Health Record. And there are templates that you can use to create your policy through RACP or RACGP. Otherwise, there are also templates through the Allied Health Professions Australia website as well. So if you want to create a My Health Record health policy and your organization works within Allied Health, you could use the template with the Allied Health Professions Australia website. And so the policy should be accessible to all staff who are using My Health Record, and it should be reviewed and updated as needed. So in order to be able to access My Health Record, you need to ensure that the My Health Record security and access policy is there. And then you can register the organization to get connected. And then after your organization is connected, then you would need to train staff so that they know what they're doing with My Health Record to ensure they're using it effectively. And to do that, you could register for any of our training sessions with the agency. We do regular webinars on all different clinical information system software programs. So we're more than happy to do some training with you if you contact us. And then My Health Record needs to be accessed by authorized staff. So those would be staff who've gone through the training and they're authorized to access My Health Record by the organization. And then there are ongoing participations with training. Any new starters that you have within your organization would also need to go through the training as well. So to get connected, you can contact our specialist connections team at the agency. So this is our email here, and I believe these slides are going to be sent to you after the presentation as well. So you will have access to this information. So you can contact us via email here or by phone number. Otherwise, you can also contact your local primary healthcare network as well. So the Hunter New England Primary Healthcare Network, you can contact them, and they can also provide support for you as well. So also on our website, we have the My Health Record Mental Health Toolkit for healthcare providers. And so this gives you a bit of an introduction to what's in My Health Record and clinical documents that are available. There's some information there around privacy and security. There's support there or support information for carers using My Health Record, how to register and connect to My Health Record, and who to contact for support. Now, I'll just show you what the resources look like on our website. So just bear with me a moment while this loads. Okay, so here, if you go to digitalhealth.gov.au, you can see all of our resources here. So these are resources for everyone, but you'll notice up the top here, we also have resources for healthcare providers. So if you click here, it opens up all of these resources. And once you get here, you can find your area of practice. So allied health, for example, you'd be able to find education and training around allied health. So there are resources there for you. Also, there's information around our initiatives and programs. And here you'll be able to access a My Health Record software simulator. So training any staff, any new staff, they'd be able to practice within a training environment. We also have online training courses as well, and you'll receive a certificate of completion after doing this course, and then that certificate of completion can go towards CPD points as well. If you want to register for any events or webinars, you can click on the link there, and you'll see we have a wealth of information here that can be shared through our webinars. So you can feel free to go through those and register for those as well. So I'll just go back to my presentation. If you require any further support with using My Health Record, please feel free to go to our website, digitalhealth.gov.au. We also have the My Health Record helpline. This is the 1-800 number here. You can email us, or you can follow us on Facebook, LinkedIn, or Twitter. Okay, so that is it for me today. I hope this presentation has been helpful so far, and I'll hand it over to you, Peter.
Thanks, Max. I'll just share my screen. Could somebody just confirm they can see that title screen?
Yes, we can see it.
Excellent, thanking you. Thanks, Max, for that presentation. That was great, and a lot of good information in there. What I'm going to do is sort of backtrack a little bit and just cover some of the basic digital health foundations, some of the areas that you need to be considering when you're embarking on your digital health journey, or even if you're partway down that track, something you may not have considered and things like that. First thing I wanted to really look at was definition of digital health. This is one that I stole. I'm happy to admit that. I didn't make this up. But digital health, a disruptive and transformational approach to the delivery of healthcare with a focus on engaging and empowering patients, activating caregiver networks, and understanding that patients are increasingly behaving as consumers of healthcare. And I really like that last part of the sentence there, and I might come back and revisit that. Digital health provides us with a toolbox of technologies and techniques that support the development of new, innovative patient and caregiver-centred models of care, driving improved engagement, accessibility, quality, safety, efficiency and sustainability into all corners of the healthcare system. And I think that's a really good definition because I think it encompasses everything that we're looking at in digital health. It's a very broad area, and a lot of people are familiar with limited parts of it, but I think when you look at it in total, it is a really broad area to look at. And patients, I think it's important, as I mentioned, that patients are increasingly want to become involved with their healthcare. They're wanting to actively be part of a care team rather than a participant. And we're seeing that, even with COVID, with pathology results for COVID tests, for example, going direct to patients, not going to healthcare providers. So we're seeing that more and more in that space, that patients are wanting to get involved, and also through the use of wearables and things like that. They're using apps like Strava, or they're using My Health, which is a Telstra app, Health Now, to access their My Health record on their devices. So there's a lot of those things that patients are actually more and more becoming involved. We saw that particularly, again, another one of the events over the last couple of years, the growth in telehealth. You know, a couple of years back, telehealth was growing, but it wasn't really used that much in practice. Now we're seeing, you know, video consults, phone consults, and patients being able to access healthcare from their home or from you know, a place that's convenient to them. And also healthcare providers as well, not having to necessarily be in the office. I mentioned patients wanting to engage. That's actually ePatient Dave, or Dave de Broncart. The ePatient standing for equipped, engaged, empowered and enabled. And I think that's really important. The patients are, as I said, they're really wanting to engage with their healthcare, not just be a participant, or an inactive participant. Of course, with data becomes information. That is actually a Strava hot map. Now, data is data, and it depends on how it's used and how valuable it is. That's actually Kandahar Airport in Afghanistan, and that's actually the tracking of the American forces over there. Probably not information that they originally thought was going to be shared via Strava, but it is an example of data can be created anywhere by wearables and things. So we need to be aware of that data and actually how it's going to be used as well. But let's look at some of the basics, and data security is probably the primary one. And I know Max spoke about this. The data security that sits behind the My Health record is military grade data security, but you know, patient data security is paramount when we're looking at any of these initiatives. And it's important that you as healthcare providers or health services are aware of that and are doing your utmost to protect it. Why is that the case? Example would be is on the dark web, for example, a MasterCard is probably worth, or a credit card number, probably worth about $1 on the dark web. A healthcare file, probably around $100. I did hear it quoted the other day, that could even be up to $1,000 at the moment. Not that I'm in the market, but it just shows the value of that information, why people are looking to access that information for nefarious purposes. The reason behind that is if you've got a credit card, obviously, you know, it can be blocked pretty quickly. The owner's going to realise it's been done, or the credit card provider will realise something's amiss with the sales on that. Healthcare data, you can go and get as many, you know, you can set up fake IDs and you can get as many credit cards as you need. So is your software security or your cyber security, is it fit for purpose and is it updated? You know, are you running enterprise level security rather than a home security package? Secure messaging, is it used to both send and receive information, or are you just using it to receive? Should you have capacity for both? Do you receive encrypted e-referrals? If you're in the Hunter, New England part of our footprint, then we have a program running called Sent e-referrals that all of our commission service providers have access to. There's no cost for that, and we'd certainly be happy to help you set up for that. And that means that GPs, if you receive GP referrals, can actually refer to you in using a totally encrypted and secure point-to-point messaging system. What do you use email for? Are you getting and sending or receiving patient information via email? Email is not a secure, not a secure form of messaging. It's usually not encrypted. And it's usually fairly weak in you know, it's point-to-point, type in a wrong email address, that data goes to somewhere else. Faxes or e-faxes, is your fax system secure? A number of people are having problems these days with faxes not playing nicely with the NBN, and they've reverted, instead of using a physical fax machine, they're reusing an e-fax system. Now, what a lot of people forget behind that system is while the initial transmission of a fax is sent, what you'll find is that usually that software then converts that into a PDF file, shoots it into an email account and sends it up to the cloud. If you're using an Office 365 environment and not hosting your own email server, that bounces up to the cloud, and your patient data is actually being stored by Microsoft. So consider that. Remote access, again, same sort of thing, remote access. A lot of people are working from home, they're remoting into systems. Your security is only as strong as your weakest point. So if you've got a team member that's remoting into your system, they're sitting at home on their home computer running Windows 7 with AVG freeware as their cybersecurity, I would suggest you've probably got a weak point. So it's make sure that who has remote access needs it, and that also how that access is occurring. Are you supplying the IT for them to access, or are they using the home access for that? Are your staff trained and regularly updated about cybersecurity? Do you talk to them about phishing emails, malware that might come through in an email? Do you, have you set up a specific accounts email for your accounts to come through from suppliers? I used to work in a general practice and we set up a specific email account for accounts so that if an account came into any other email address, whether it was one of the doctors or the reception, they knew just to hit delete because all our suppliers knew send your bills to our accounts email address, and that way they'll get paid and everyone else is going to delete them, because a lot of companies or a lot of hackers will try and hide malware or phishing emails or scams inside of a document, might be PDF, that says here's your invoice for something. So that's how they're actually accessing into systems. User permissions, do they allow staff to work effectively within their job scope? So have you got administrator rights for the right people? Can the right people actually install a printer, uninstall a printer, change a printer, install a program if they need to? On the reverse of that, have you got it locked down so that your junior staff who don't need to be doing that sort of work can't actually install a program that may be actually malware or something like that onto your computer? So who's got that administrator access, who doesn't, and do they really need it? Passwords, are they changed regularly and are they complex? I've said this 1,000 times, but I'll say it again. Password is not a password. Password 1 with a capital P is not a password. They should be complex, usually 8 to 10 characters in minimum, mix of uppercase, lowercase letters, numbers and symbols, preferably random. And I know that becomes really hard to manage when you've got a number of passwords. There's a lot of good quality password manager software providers out there. Perhaps look at using those. If that's not an option, then at least make sure you're using, and if you have to use words, use a combination of words that don't normally go together, don't use a name, and put in, again, replace some letters with symbols or something like that to make it a little bit more difficult to hack. Software, any of your software that you're running, are you running it up to date on the latest version? And don't delay any upgrades that might come through for your clinical software or your operating systems. Because the reason a lot of the time that software gets updated or a new version might come out is that's going to have a security patch that might address what some of the latest security threats. So make sure you're continually updating your software. I mentioned e-prescribing. Again, it doesn't apply to probably all of our audience today, but I know we do have some Aboriginal medical services and general practices that are maybe in the audience. If you're e-prescribing, it is just another digital tool to help you and your patients. So you can use token-based scripts. There's active script lists are now available that patients can actually have a whole range of medicines and liaise direct with the pharmacy. They do require a NAS certificate. Again, and that's something that you may require for your My Health Record access. So if that's something you need, setting up that Proda account or getting that NAS certificate issued, that's something we as a PHN can also help you with. E-requesting and pathology and imaging, again, probably specific more to the general practice type environment, but again, they're becoming more and more prevalent. And if you're not using that in that space, then it's worth investigating that and talking to the providers, your practice management software providers or the imaging and pathology companies to get that set up. Backups, critical. Are they done daily? Are they stored off-site? Your data is only as good as if you can access it. So if you did have an attack and your database gets quarantined or something like that, can you restore back from a backup? Is it up to date? Is it stored externally on an external drive, or do you use a cloud backup? That's up to the business. I'm not recommending one over the other, but make sure you've got it there. Do you have a secondary server? So if your primary server goes down, can you get back up and running with a secondary server? I'm not advocating you necessarily need to have 2 servers, but if you supersede a server, why not look at using the old one? Can you use that as a secondary server just to get you back up and running? And finally, have you tested your backup recovery process from a backup? It's only as good if you don't test it and it doesn't work, then you're in trouble. So make sure you're testing that at least annually to make sure with your IT people that you can actually get that information back up and you can get back up and running. Your website, again, another digital health tool. Does it represent your organisation in a positive way? Is it informative? Is it engaging? Have you got information pages about how to make an appointment? What are your hours? Where are you located? Has it got information about you or your clinical team and the services that you offer? Because people are more and more shopping online and they're wanting to get that information. The other thing is to keep it updated. Make sure the information is current. Procedures, Matt's touched on policies and procedures for the My Health record. If you're running, again, any sort of health service, you should have policies and procedures in place for your social media, for your email and internet, secure messaging, as I mentioned, My Health record, e-scripts, data, privacy policy. Make sure all those policies are in place. Make sure staff know where they are. Make sure staff know what's in them. You know, you've got to be able to not just talk the talk, you've got to be able to walk the walk. So make sure your staff know what those are in those policies and procedures manuals, and make sure that's actually what they're doing day to day. Because that's, again, going to help protect you. If they're aware of what actually is your privacy policy, who can they give information to? How do they use social media? How do they use email? What's your internet policy? That makes life a lot easier for you when you're dealing with staff day to day. IT suppliers. Do you use an IT supplier or do you do it yourself? I would argue these days that anybody that's doing IT that doesn't have a background in IT is probably running a fairly large risk. It's a very specific area and you really do need to know the basics, and it's the old story, if you don't know what you don't know, and that's the bit that's going to get you into trouble. In some cases, you know, does your IT have specific health industry knowledge? That's vital in some aspects. I know in some areas it's hard to find somebody locally that can do that, but if you can find someone that's got industry with using a lot of the health-based software packages, that's going to make life a lot easier as well. Do they consult with you, or do they do the work and just send you an invoice? As an ex-practice manager, I know you need to be across what the IT guy is doing. You don't need to know the details, but you need to know what they're doing, why they're doing, and why you're getting an invoice for that work. As an office manager, practice manager, business manager, do you know what your IT administrator passwords are? You should have that information. They shouldn't be stored just by your IT supplier. You should have that information, because if something happens to your IT supplier, you don't need your whole system to have to be broken down and restarted. If you've got those IT administrator passwords, another supplier could actually step in and take over that running fairly quickly. And if they won't give them to you, I'll ask the question, does your IT consultant work for you, or do you work for them? I think that's important as well. You need to, it is a partnership. You need to know what's going on in that space and how that's impacting on your business. And that's it from me. I might stop sharing and we can go back and answer some questions.
Thanks, Peter, and thanks so much for the overview, Max, as well. Let me just up to the right page and open the floor to questions. Certainly there was a lot of information there, and